Hello everyone, today we'll speak about Hurler syndrome. So Hurler syndrome is a type of mucopolysaccharidosis. It's a genetic lysosomal storage disorder. It happens due to the deficiency of the enzyme alpha-L hydrogenase. So, for its inheritance pattern, it is an autosomal recessive disorder. So we need the both parents to be carriers at least to till we get it to the baby. The incidence is approximately 1 in 100,000 live births. And for the genetic mutations, we will have mutation in the IDUA gene, which is the alpha L hydrogenase gene. Pathophysiology. First of all, we will have an enzyme deficiency. The lack of the alpha L hydrogenase lead to the accumulation of the glycosaminoglycans, GAGs for short, in lysosomes. So GAG buildup causes a multi-organ dysfunction and abnormal cellular function. So this is Hurler syndrome. We see we will have a frontal posing, we will have an intellectual disability, we will have gap teeth, we will have corneal clouding, depressed nasal bridge, short neck, hepatomegaly, and splenomegaly. This is another picture. Also, we will have thickened tongue, and yes, I mentioned other things. This is just our vision, corneal clouding, hypertrichosis, which is like he will have a growth of hair on the face and back more than normal. Failure to thrive, they won't grow as much as the normal people. And dysostosis multiplex, which is something that we will see in the X-ray as a diagnostic way. We'll speak about it a little later. And inguinal hernia. I'm sure everyone knows the hernia. So this is the corneal clouding. This is a patient with Hurler syndrome. As we can see, the nose shape, the frontal, what do you call it? I forget. The frontal posing, the gap teeth, the short neck. Also, there's no teeth here, but look at the nose. I think they have a unique shape, and this guy is really handsome. So for the diagnosis, we will do first of all, based on the clinical findings, we will see the patient like this. We will have a suspicion that he have it. Then we will do an enzyme assay. We will measure the alpha L hydrogenase activity in a blood or fibroblasts. We can do also genetic testing to look for the mutations in the IDUA gene. Additional investigations include urinary glycosaminoglycan analysis. It will be increased in this case, or usually there's 0, so we will have it in the urine. And we will do a radiology, and we will have dysostosis multiplex. So this is dysostosis multiplex. So we will have some problems in the joints and the bones. First of all, we will see that the metacarpals are not developed correctly, and they will point toward the proximal side. The phalanges will look like a bullet shape, as we can see. It's like a bullet. And in the hip, we will have a hypoplasia of the ilia, as well as if we have another X-ray for the I don't have, I think. For the vertebra, we have a lot of problems in the vertebra. Maybe I'll do just a short video after this one, just explaining it, because it has so many details, to be honest. So for the management and treatment, enzyme replacement will be good. Hyaluronidase is the main treatment to reduce the GAC accumulation. Hematopoietic stem cell transplantation may improve the neurocognitive outcomes. And we will do a supportive care. Since this disease will cause problems in a lot of systems, so we will do a multidisciplinary approach of treatment. And there is still an investigation for a gene therapy. For the prognosis, without treatment, the prognosis will decline in physical and cognitive functions. But early treatment will improve the quality of life and prolong the survival. For the long management, we will just keep an eye on all the system and do a follow-up for the supportive care to make sure there's no decline in the condition. That's actually everything for this short video, let's say. Thank you so much for watching. I hope you found it useful. Have a great day. Goodbye.